Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The federal government takes delivery of 2 million doses of Johnson & Johnson COVID-19 vaccine donated by the European Union. Enugu State government asked Southeast governors and health authorities to intensify daily vaccination against COVID-19. And Australia announces reopening of its borders to vaccinated tourists and other visa holders for the first time in almost 2 years. Thank you for joining us. South Africa, Morocco, Tunisia and Ethiopia are among the countries with the most cases on the African continent, as the Africa Center for Disease Control and Prevention, Africa CDC, says a total of over 10 million COVID-19 cases have been reported on the continent. This is as the Nigeria Center for Disease Control, NCDC, reported more COVID infections across the country, with new infections recorded in 4 states and the Federal Capital Territory. Here's more on the pandemic update.
36 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 4 states and the FCT. That's a drop from the figures reported earlier. Lagos accounted for the highest number of cases with 23 infections. FCT had 5, Osun had 4, Taraba 3, while 1 case was registered in Nasarawa. The total confirmed cases in Nigeria now stands at 253,727. The report also includes a backlog of confirmed cases from Taraba State, as well as 0 cases from Ekiti, Kaduna, Ondo, Ogun, Osun, Oyo, Plateau and Sokoto states. 81 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,045. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,139. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by Ondo and Benue State. Over 15.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 6.1 million of the population have been fully vaccinated. In Africa, over 10.8 million persons have tested positive, while over 241,000 deaths have been recorded across countries on the continent. The total global confirmed cases has surpassed 395 million, while deaths are now beyond 5.7 million.
The federal government has taken delivery of 2 million doses of the Johnson & Johnson COVID-19 vaccine. The EU ambassador who made the presentation of the vaccines in Abuja notes that the donation is part of the EU's commitment to jointly combat the pandemic. The Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib, says that the federal government has procured over 39 million doses of the J&J vaccine through Afrexim Bank. He, however, notes that only about 12 million doses of the single shot is currently in the cold store.
With today's donation of 1,936,050 doses of the Johnson & Johnson vaccine through the European Union, we also have a stock of about 10 million doses of the vaccines that have been donated through the COVAX. We have no doubt about the commitment of the European Union to the eradication of COVID-19 globally and in Nigeria in particular. So the onus is now upon us to make rational and effective use of these vaccines. As I've mentioned in my previous communications, we'll be focusing the use of the Johnson & Johnson vaccines in the hard-to-reach areas, riverine areas, desert areas, security-compromised areas. This is because we want to seize the opportunity of the single-dose vaccination to reach these populations at the earliest opportunities and not worry about the fact that we'll have to go multiple times. The next time we'll be going will be to give booster doses, and this makes it a whole lot easier than having to navigate three potential jabs to each individual in these areas that are particularly difficult to reach. I would like to assure our partners that we will ensure a safe and equitable distribution of these vaccines. Let me also mention that the availability of the different vaccine brands does not in any way mean that some categories of people are going to be selected for a particular type of vaccine. What we're going to be using is the accessibility, making sure that every single Nigerian, no matter where they live, has the opportunity of access to these vaccines.
Over to Enugu State, where the state government has urged Southeast governors and health authorities to intensify the daily vaccination against COVID-19. Speaking at the opening of the Southeast Zone Primary Healthcare and COVID-19 Vaccination Review meeting in the state, the Deputy Governor of Enugu State, Mrs. Cecilia Ezilo, admits that the recent statistics of daily and total aggregate COVID-19 vaccinated figures from the zone remains low compared to other zones in the country.
The federal government wants us to integrate primary healthcare services with the ongoing COVID-19 vaccination program. Admittedly, we have not done well, but with this stakeholders meeting, we will quickly align on documented best practices, and we promise to address the current challenges, including the vaccine hesitancy, routine immunization, and antenatal care services, which have been negatively impacted by the outbreak of COVID-19 in the country. Before I go further, I want us to adopt all that the senator representing Enugu North and then the House Committee Chairman has told the Igbos. He has told us the sober truth. And I want us to go down, take it down to the grassroots. And I want to use this medium to ask all the executive secretaries to please interact with the local government, with Ndiwe, town union presidents, etc., so that this message can go down to the roots.
As COVID-19 pandemic poses serious threats to public health globally, Nigeria faces a potential public health crisis due to the COVID-19 and other infectious diseases such as Lassa fever. Well, recently, the NCDC announced that more than 30 people have died of Lassa fever since the beginning of the new year, with 170 cases in 3 weeks. Amidst this public health concern are health workers who are in the front line of the fight and who also get infected and sometimes lose their lives to the disease. The Dr. Akiala Ishako, a virologist, joins us for more on what this trend means under the current coronavirus pandemic. Thank you for joining us on the program.
Thank you, Melissa, for having me. Good evening, Nigerians.
Good evening. Lassa fever and COVID-19. What are the similarities, the differences? And is it time we shifted focus to tackling Lassa fever?
Lassa fever and COVID, all of them are viruses. They belong to the class of the virus we call the RNA virus. So we have two types of viruses based on their genetic makeup. We have the RNA and the DNA virus. So both Lassa fever and COVID-19 fall within the category of the RNA virus. The difference is that one is a viral hemorrhagic fever, the other one is respiratory syncytial virus. Their mode of transmission differs. One, it is Lassa fever, it is basically through foodborne. When rodents like rats infect food products, and then, they are transmissible to humans through contamination of food materials. COVID-19 is basically airborne. But one of the unique things about the two viruses is that they present clinical signs and symptoms of cough or fever, sometimes difficult in respiratory, difficulty. So basically, these are the similarities and differences. You asked a very valid question whether we should have a paradigm shift to focus on Lassa fever. I want to say that there is no need to have a paradigm shift to focus on Lassa fever. It will be good for us to have a holistic, integrated approach in handling most of these epidemics. Melin said we are having an epidemic in a pandemic with a very weak healthcare system. Our hospitals have been overstretched. What we just need to do is to see how we can support our surveillance system. Melin said even in the outbreak of Lassa fever, if journalists even report Lassa fever more than even before medical personnel should be able to dictate it. One unique thing about Lassa fever in Nigeria, it is that it is seasonal, it is cyclic in nature. So it gives us an ample opportunity if we're able to understand the dynamics and the seasonal variation in terms of transmission for us to handle it. So I think instead of having a paradigm shift to focus on Lassa fever, we also have other infectious diseases such as the meningitis, such as cholera, and all what have you. All what we need is a robust, integrated approach in surveillance.
We also understand a report by the National Library of Medicine saying that, coexisting with COVID-19 and its impacts, cases of Lassa fever, especially in West Africa, have been underreported. And one of the reasons they gave was, hesitancy in visiting clinics, contributing to the silent outbreak. But sadly, we've also lost some frontline workers to Lassa fever. What do you think is responsible for this trend?
What is responsible for this trend is basically a lack of environmental sanitation. In where we come from, our environments are so dirty, and that's where most of these rodents that transmit this Lassa fever, this Lassa virus, cohabit with human population. You are right that we have issues of nosocomial infection among healthcare workers. This year, we lost 2 doctors from my state because of Lassa fever. So what is also responsible for this trend is that even within hospital environment, we don't take precautions when it comes to infection prevention and control. That is the IPC component. So having a paradigm shift from our lack of proper environmental hygiene to the understanding of how infectious diseases transmit even within hospital environment is also key for healthcare workers. We also need to actually do a robust capacity training. Not all health workers can be able to pin down the clinical signs and symptoms for Lassa fever. And so sometimes you assume that you are treating malaria, you assume that you are treating some typhoid fever, not knowing that you are also handling a Lassa fever case. So healthcare workers need to have a high suspicious index when it comes to handling of cases, generally when it comes to presentations of by clients. So the trend continues because of lack of proper understanding of the disease dynamics and because our environment are so dirty and then we don't keep our environment clean. And then also the even the reporting, like I said earlier, journalists even report Lassa fever more than even medical personnel. So we must have a robust system of how we can be able to pin down cases and begin to report them accordingly.
All right, shifting focus to all of the pandemics and epidemics as well. We appreciate your time always on the program. Dr. Kiela Shako, a virologist, joining us from Abuja studio. Thank you.
Thank you for having me.
We have more on the COVID-19 update program when we return. Please stay with us. Welcome back. The Honorary Consul General of Sweden has been speaking on his country's response to the coronavirus pandemic. According to him, Sweden is still suffering from COVID, with government hoping to lift restrictions. He hopes that things can get back to normal as soon as possible to aid economic recovery, among other things.
We're still suffering from the pandemic, to be honest. So I think we expect economic recovery and more business and business cooperation between our countries. And this new honorary consulate is naturally a part of it, of this, strategy in a way to get back to cooperation and business, doing business together. So more traveling and more business cooperation in different fields. Let's hope that there is no new variant more dangerous or deadly than the Omicron, which is very transmissible, but not that dangerous. But you never know, and we have to live with threat of new viruses, not just COVID, but next time it could be something else. So that's part of the globalization, and people need to continue vaccination in all countries, so that is very important to beat this virus once and for all. It was a big blow when I was in Nigeria when COVID broke out in March 2020. So I've seen the entire journey, and now we're coming out of it. I think the light in the tunnel.
We were speaking on the sidelines of the honorary consulate, which officially opened in Lagos. And the US government has made COVID-19 a top priority for all Americans as they work to ensure that the youngest Americans are eligible for vaccines and consider the possibility of boosters for children 5 to 12 years of age. Our correspondent in Washington, Maria Bird, has more.
U.S. COVID-19 death toll has reached another grim milestone, surpassing 900,000 deaths since the beginning of the pandemic, and in just under 7 weeks, 100,000 deaths. While death tolls continue to rise, the number of daily cases over the past 7 days have significantly decreased.
The current 7-day daily average of cases is about 446,400 cases per day, a decrease of about 36% over the previous week. The 7-day average of hospital admissions is about 17,100 per day, also a decrease of about 14% over the previous week. And the 7-day average daily deaths are about 2,300 per day, which is an increase of about 4% over the prior week. While we continue to see large decreases in average daily case counts across the country, hospitalizations remain high, stretching our healthcare capacity and workforce to its limits in some areas of the country. And daily deaths also remain quite high.
As the number of vaccinated Americans continues to increase, parents of children 6 months to 4 years are concerned about their children's inability to be vaccinated.
We would have vaccines available for essentially all age groups in America. This would be a major milestone. Now, there are a number of steps ahead to determine if the vaccine is both safe and effective for our kids under 5. And please know that the FDA will not cut any corners in their review process. They know that they are the gold standard that all of us rely on. If and when the FDA and CDC decide to move forward, we will work closely with our trusted community partners to ensure that families have accurate science-based information about the vaccine so that they can make the best decisions for their children.
Americans are hopeful that as the winter begins to end and vaccine rates continue to increase, that the pandemic will become less of a factor within everyday life. From Washington, Maria Bird, Channel Television News.
And Maria joins us right now. Hi, Maria. Over the weekend, the grim milestone, 900,000 deaths was reached. Are there other factors that are putting people at a high risk of COVID-19? Because compared to other countries, perhaps in Europe, there seems to be something different happening in the United States.
Well, you're exactly correct. There is something a little different. But I will say that, as we all know, that when you have higher case counts and then obviously higher hospitalization rates, it takes a week to 2 weeks and almost sometimes a month for those death rates to catch up with the decrease. And so that's really what we're seeing right now. We had obviously the Delta variant was very, very strong within the US, especially for those individuals who were not vaccinated. It ended up having a heavy toll on the hospitalization rates. And obviously, then unfortunately, many people did die as a result of that. We are beginning to see a phasing out of that Delta variant. And the Omicron variant obviously is the variant that we're now seeing that's causing the most number of cases in the U.S. But that death toll rate we should begin to see in the coming weeks should be decreasing as we continue to see the number of cases decrease as well.
But a number of people wonder how you tie them together. Death tolls are rising. On the other hand, a decrease in confirmed cases. And then what role is Omicron playing if it's majority of the variants in terms of the infection and we're having less, the Delta variant being totally phased out?
Yes, the Omicron variant has had a major impact on the number of cases, but what we've also seen is a heavy increase in the actual vaccine rates. We can also tie this to the 5 to 12-year-olds being vaccinated. We know that that group of individuals are in the elementary school age. Those age groups are highly, they physical, they're in close contact. And so the spread was obviously much easier in those environments, which then would make it susceptible to the parents and elderly individuals that they might go home to. And so the spread case with the Omicron variant was just at a much higher rate than what we had seen before. And so that heavily played into the role of the case counts. But as we see vaccinations coming into play, we are seeing a decrease in cases, which then means it's been also a decrease in testing. We know a couple months ago you would see lines around buildings for testing, but now with the increase of testing availability within the schools, within even having the federal government send tests to individuals' homes for free, and the ability to have free testing home kits, that is also assisted with seeing the decrease. And so there's a number of variables that are helping to ensure that individuals are having a reduction in the number of cases, which then we will begin to see, obviously, a reduction in hospitalizations hopefully soon, and then a reduction in the death tolls as well.
What have you heard, especially parents' concerns on vaccination? Are they comfortable about kids under 5 for COVID-19 when there is the final approval?
There's a major concern for those parents of kids under 5. I think that we're beginning to see that 5 to 12-year-olds are beginning to safely interact with one another, having what many consider play dates with friends, going to the playground, feeling comfortable with that. But for those individuals who are in their early developmental stage and they're really trying to figure out socialization and appropriate play, to not be in an environment that allow them to do that, due to the fact that they are not vaccinated or don't have the ability to be vaccinated, has major concern for many parents. Even the U.S. Surgeon General announced and said that, that's a major concern for him, as he has a 4-year-old child that's not able to be vaccinated. So Pfizer and obviously the FDA are really working hard to try to see if there's any way possible, with obviously still making sure they do all the appropriate requirement checks for those under the age of 5 to be vaccinated. But we are expecting that definitely by the spring, when we know the weather will be better as well, those individuals should also be able to get vaccinated.
Our Washington correspondent, Maria Bird, many thanks. The Australian government has announced it will be fully reopening its borders to travellers from February the 21st, 2 years after they were shut to slow the spread of COVID-19. Prime Minister Scott Morrison, however, ruled out conditions for travellers wishing to enter the country. Here's more on the global update.
The Australian Prime Minister's announcement came on Sunday evening in a press conference where he said Parliament will be debating the reopening of borders this week.
We are looking forward to be able to make that decision to open up our borders and welcome visitors back to Australia again as soon as we safely and possibly can. But I really do not believe that is far away.
Australia has nearly 95% of population aged 16 and over double vaccinated against the coronavirus, and nearly 9 million people with more than 2 doses. The country requires all international travellers to be vaccinated or provide a medical vaccination exemption evidence to enter the country. Over in the United States, the prolonged COVID-19 pandemic has worsened teacher shortages across the country, along with other factors like low wages and frequent shootings in the past decade, driving an increasing number of teachers to leave the posts. The student population in normal colleges is decreasing as well. As a consequence, there are not enough teachers to fill the vacancy. The pandemic stands to make things even worse in some rural areas, where the steepest declines have been recorded. Honduran President Xiomara Castro has tested positive for COVID-19, though she says she has mild symptoms and will be working in isolation. The 62-year-old who put the left back in power 12 years after her husband was ousted in a coup was sworn into office in late January. Taiwan's presidential office said President William Lai, who met Castro in Honduras last month while he was there for her inauguration, was in good health and his COVID-19 tests had all come back negative. Finally, a COVID-19 vaccination drive for children aged 5 to 11 has launched in the Philippines, featuring a circus-themed inoculation center complete with still walkers and puppeteers. Performers made balloon swords and performers in superhero costumes posed for pictures with kids at the center in Manila. The Philippines Food and Drug Administration has so far only approved a lower dosage of the Pfizer vaccine for use in children. The government aims to vaccinate over 15 million children in total.
Fun way to get jabbed. You can visit our website, channelstv.com, for more updates, a better understanding of the pandemic. There are the stories, breaking news at your fingertips. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.